My name is Julie Lincoln. I am a clinical manager here at Epoch Sleep Centers, and today we've created this video to show you how to operate your APAP device when you get it home. At this point, you've met with the respiratory therapist who has gone over your sleep study results with you, and will now show you the machine that the doctor has ordered for you. Basically, APAP means automated CPAP pressure. So this machine is pre-programmed for you at the settings your doctor has prescribed, and the machine will automatically adjust the pressure during the night based on whatever your requirement is when you're sleeping. The machine you're receiving today is an S10 AirSense Auto. It has a built-in wireless monitoring system. It also has a built-in heated humidifier. The unit is all one piece. It does have a 2-year warranty. Should any troubleshooting, any issues happen with the unit, always call Epoch Sleep Centers and we will replace the device if needed within that 2-year warranty period. In setting up your device at home, it does have one plug-in. It has the AC adapter in the back that will insert into the plug, and the other end should go to a grounded outlet. If you do have to use an extension cord, always use one with fuse protection built in. It does have a heated humidifier built into it, and basically you'll want to just kind of squeeze, pull that out, open it on the side, and they recommend that you fill through the top just to under this max line with distilled bottled water. Also keep in mind to never move the device when it is filled with water. Make sure before cleaning that the water is always dumped out. Also in the back of it is your tubing connection, which is a heated climate tube that squeezes into the back outlet, and you'll want to just squeeze that to either take it out for cleaning, make sure it always clicks into place when adding it back on. On the side of your device, there is one air filter. Again, with once a week cleaning of the external parts, you'll want to remove your filter. They do recommend that you either use a damp face cloth or a toothbrush to clean off any dust or dander that does build up on this filter. Most insurances do cover the filter to be replaced once a month. Any replacements, always contact us directly. When you do place your device at home, make sure you always leave this area open to free air, unblocked, because that is the air supply of the pressure that you'll be breathing. At night, before operating the device, always put your mask on first, and then one touch will turn it on, same to shut it off. The wireless modem that is built into the device is on a data connection. It does not need to be connected to any wireless internet at home. The machine also has built into it a separate memory card that will always store 1 year's worth of information in the event we're not receiving data from your modem. Again, there are several ways to get data. As clinicians, we do review your data for the first 3 months. The unit will provide to us if there's a reason we need to call to follow up, if your apnea is increased, if your mask is leaking a lot during the night, anything that may affect the benefit you should be receiving from your treatment. The unit will signal that to our staff and we will give you a call to follow up. Also, the My Air tool for patients, either via mobile app or online, is another great way for coaching and to get feedback on how your therapy is working. For infection control purposes, it is recommended that all parts and pieces are cleaned once a week, typically with a mild dish detergent and warm water. Usually patients will clean the inside of their water chamber, their tubing, filter, and mask system weekly. When cleaning your tubing, unhook from the back of the device. Make sure that you thoroughly soak the tubing in the soapy mixture along with your other parts and pieces. Flush it through with that soapy mixture, and then rinse everything well. Let it air dry before reconnecting to the device. Typically, patients once a week will flush the tubing, let it air dry, hang from either a shower rack so that the tubing can fully dry out before reconnecting into the unit. Displayed here are 3 main styles of mask. There is full face option for patients who typically are more comfortable mouth breathing. a nasal mask, which goes around the nose, and the nasal pillow mask, which sits gently into the opening of the nose. One touch will turn on the device. The screen will light up for you so that you can see your settings programmed in. After a few seconds, the device will shut off the lights. If you want to see the screen to make any adjustments, just press your house button once. You'll see on the main screen the pressure setting that your doctor has prescribed. In the middle of the circle will always show the amount of air pressure that you are receiving. The unit is programmed to, for 20 minutes, start between 4 and 5 centimeters of pressure. This 20-minute time frame that you're seeing is called a ramp time. Basically, the device will delay the pressure from adjusting for the first 20 minutes every time you power up the device. The ramp time is a comfort feature to allow the patient time to fall asleep, waiting for the pressure to adjust until apneic episodes begin. The patient does have the option to adjust that time frame, and we will go through that in the My Options menu. In the bottom right corner is the heated humidifier setting. You will see there it is programmed in auto mode to start at this time. The unit does have 2 humidity functions, manual mode or auto mode. Typically, patients begin therapy in heated humidifier auto mode. That means that the unit will adjust the humidification and the temperature of the pressure to the temperature that's in your room. Hitting that button again will power off the device in the morning when you're done, and you will see a sleep report. The unit will tell you your usage hours for last night. It will give you a smiley face if your mask had a good seal overnight. If you wake up and you see a frown next to mask seal, it typically means that the mask needs to be adjusted a little bit better the next night. Next to humidifier, you should always see a smiley face, which means the humidifier is heating up and functioning as it should. And down the bottom where you see My Air means that the machine is linking all of the data to that online portal via the modem. You will also see in the top corner a little snowflake blinking when you power the device off in the morning. Basically, that means that the unit is in cool down mode. That snowflake will blink for about 10 minutes and then the device will fully power off. Some patients do experience some light airflow through their mask when they first turn the machine off in the morning, and that's usually because it is in cool down mode. To access the patient menu, hitting the house button will get you back to the main screen, and My Options is the patient menu. Clicking on the dial, you will then be able to move through each setting and make adjustments to your comfort. Again, ramp time is the first option, which is the delay time of the pressure setting. You can click on that and adjust that anywhere between 0 increase time to as high as 45 minutes. And again, this is for patient comfort. Click on it to accept the change. Climate control is your heated humidity setting. Right now, it is set in auto mode, where the machine will automatically adjust the humidity. But if a patient is getting dry mouth, stuffy nose, any irritation, to get more moisture, simply go in, click on manual, and now you will see that it allows you to adjust the temperature and also the humidity level. Typically, if patients are experiencing any dryness, humidity level should be slightly increased. And again, these are settings that are specific to patient comfort. Mask should be set at whichever interface you're using, whether it's a nasal full face or a nasal pillow mask. This will adjust the amount of leakage that the machine will account for based on whichever interface you are wearing. The other options in the menu are tools to help the patient. Run Mask Fit allows you to see if you have a proper fit with your mask. Put your mask on, click on Run Mask Fit, and the unit will do a fitting and adjust the pressures to help you figure out if you need to tighten or loosen your mask at all for benefit. Run Warm Up is a feature to pre-warm your humidifier. If a patient is adding cold water or prefers the humidity to be somewhat warm before putting it on at night, hitting Run Warm Up will preheat the unit for 20 minutes prior to powering your device to sleep with. The last option in the menu is airplane mode. This allows patients to turn off the wireless connection should you travel with it or decide that you'd prefer us to read your memory card instead of retrieve the data wirelessly. You do have access to power that on or off. And hitting the house button will get you back to your main screen. We hope this video tutorial has been helpful to you. You can always find more information by contacting us directly or going to our website at epochsc.com/patients. Thank you for choosing Epoch.